Good to have you, colleagues. For all of you on Zoom, we welcome you this morning. For all those of you joining us on Channel 22 and on the GIS Facebook page, and of course in the diaspora, we say a special good morning to you. We have with us here this morning the Honorable Delma Thomas, Minister in the Ministry of Health and Social Security, with responsibility for hospital and community health services. She's closer to me. And we also have with us Mrs. Hannah Julian St. Paul. She is the Acting Permanent Secretary with responsibility for hospital and community health services in the Ministry of Health and Social Security. So it's basically an introductory session this morning. So I will hand you over to the Honorable Delma Thomas.
Thank you. Thank you. A pleasant good morning to you and good morning to our media professionals, ladies and gentlemen, and people listening and viewing across Grenada, indeed, and the world. Given the experience of the global pandemic this year, we all have been forced to rethink our approach to healthy living, and by extension, healthcare as an aspect of mediation to the broader concept of healthy living. To face this unique challenge, our Prime Minister and the team have felt that it is important and crucial to address the issue of the management of the sector so that equal and appropriate focus will be placed on the issue of wellness on one hand and the issue of care on the other. This is the fundamental philosophical context that went into having the Ministry of Health, which will primarily deal with administration and the direction and management of such public health challenges such as COVID-19 and dengue, two relevant challenges of this time, and that of community health services and hospital services. As you are aware, I've been assigned the task to head hospital and community health services, accepting the challenge while understanding the historic difficulties we have had with our health institutions. Those challenges have been cross-generational and multi-dimensional. That said, we are approaching this time with an ambitious but clear-eyed vision. The poor health services are not a given, and that our collective commitment to people and our united national determination will allow us to achieve better outcomes. The government has renewed its commitment to the sector, and starting in the next budgetary cycle, we have been assured that more allocations will be given to ensure that we succeed. And even before the next budgetary allocation, we will get assistance as it relates to funding to crucial and very important services and equipment as it relates to healthcare. But it must be made clear that the challenges we face in the sector are not just down to financing. Indeed, some may even argue that this is not even the biggest challenge. Issues of general management, human resource management, management of other resources, social and community consciousness and commitment, and personal attitudes to the issue of care are fundamental areas in need of urgent attention. We believe that we have a good team, committed, professional throughout the health services sector, many who are highly skilled and deeply passionate. Our task is to develop a system that will get the best out of them. The consequences of doing otherwise will be too dear for ordinary families, including mine, throughout this country. In my first 2 weeks as minister with responsibility for hospital and community health services, I've had the opportunity to visit and to meet with the management of hospital services and other healthcare professionals at the General Hospital and the Monge Hospital. In fact, we have had 2 meetings with hospital services. The first one, identifying the challenges, which last for maybe more than 3 or 4 hours. Then on Friday, we had a working lunch where we looked at the way forward. We also met with Monge Mental Hospital, and so everyone knows this is an area of healthcare that is dear to my heart. This week, we will meet with the Princess Alice Hospital, and that day too is within my constituency and is so dear to my heart. And also, we will meet with the Mount Royal Hospital. We'll do our first meeting via Zoom, and then we'll make a trip so that we can visit and see and be there with them. And we'll also plan to meet with our community health management first, and then we'll walk to see exactly what is happening in the different communities as we plan our way forward to tackle those issues that confront healthcare. In short order, we will do what it takes and work hard with our team to explore solutions for those issues that confront us. I want to assure you that we will not only be in the offices, but we'll be on the ground, in the hospitals, in the community, seeing and feeling what our healthcare professionals are seeing and are feeling, so we will be better, we'll be more informed and better able to assist and champion the cause for providing better health services for the people of Grenada, Carriacou, and Pidi Martinique, and even working to boost the morale of our staff, because we also understand that that is so very important and there are many issues. Last weekend, as many of you might have already heard, we had a community-inspired cleanup of the external and some parts internal surroundings of the General Hospital. I want to use this opportunity to thank the scores of many people who participated in this activity. But I also want to place on record our special thanks and appreciation to M&N Hardware, Francis Mahan and company, who spearheaded that initiative, who provided us with all the cleaning agent, all the brooms and all the mops and everything that we needed to accomplish that deep cleaning we had at the General Hospital. I also want to thank those who gave the food and the cooks at the Maribor Hospital and the other members of the business community who assisted us. I also want to thank my colleague, Minister Louis, who reached there before me and surprised me by being there, because I only asked for assistance from members of the different constituencies. So I want to thank everyone for being there. So this is just the first phase in terms of the cleaning. Second, in November, we would see, we realize that there are some issues of mold on the walls in our cleaning, and therefore many businesses reach out to us after that first phase and after we posted. So while there are some who believe that it should not be posted, but that was awareness, because people even living abroad have committed to providing assistance as we move forward. So in November, we will have the removal of molds. Some professional painters will give a facelift to the General Hospital. And then we will proceed with beautification as we go into the Christmas season, bringing cheers and joy on the faces of our patients and even our healthcare workers. And we are even going bigger, because in that first phase, we have introduced what you call adoption of award. And we were happy by the outpouring of support from the business community, Corporate Grenada, who are willing to adopt award for providing beautification and minor repairs. Major repairs are always the responsibility of state, but the business community will assist us if a door go bad, a window go bad, or painting and beautifying. We will have that program launched in short order, where we will give them the adoption certificate of the particular ward that they are adopting. And we also call on the other members of Corporate Grenada to join on board as we look to solve and tackle all the issues that confront us as in the healthcare sector. As importantly as cleaning the surrounding of the hospital was, and most significant about the weekend, is that we were able to send a signal to the entire national community that we are determined to involve all levels of the community in finding solutions to our problems. Indeed, the challenges are great, but not insurmountable. Through the grace of God, because I believe that if God has led me thus far, then he will see me and the team through. And so I am counting on him to lead us through. I am extremely hopeful that together we shall rise to the challenge of the moment, and we would not be focusing on the past, but we will be inspired by what can be. When it comes to hospital services and community health services, let the period of recrimination and pointing fingers be over. Let a new period of accountability and possibility begin. We are committed and we will work to ensure that we provide the necessary services that is needed for healthcare. And as just yesterday, I want to report that Cabinet, after our discussion and our deliberation on our way forward with our managers at the hospital, yesterday Cabinet approved the hiring, the service of a urologist, and also approving the procurement, the finances for procuring new equipment for the urology surgery. As we go forward, as we look at the different challenges that confront us in the healthcare sector, as we also appreciate that it cannot only be about hospital services, we also have to look at prevention. We also have to look at those issues, for example, those lifestyle diseases like diabetes and hypertension, that after the lockdown we have seen scores of persons falling sick with stroke and other complications of those lifestyle diseases. And so education must be an integral part of what we do at the level of the community. Decentralization of services will also be on our agenda as we look to make healthcare more accessible to our ordinary people. We will work with central government in terms of addressing all or most of the issues. We also appreciate that cancer is the leading cause of death in Grenada, and therefore we ought to look at an aggressive program in terms of education, because a lot of the cancers are can be prevented and can also be dealt with early if you do follow take your particular examination, like a pap smear or the breast test and all those stuff. So we will be working to ensure that we deal with those issues, and not only the issues of services, but we are also aware that there are issues as it relates to our staff. We know that some of our staff are demoralized because of particular issues. And so we will work together with the management and with our staff. We'll be there with them. We'll be hearing from them. We'll be on the ward with them, and therefore better able to address those issues. So in the coming weeks, you will get more of what we're doing as it relates to healthcare. In our budget, which will be sometime next month, you will get a more detailed agenda of how we move forward, how we decentralize the services at the level of the community, how we provide more services at Princess Alice, and how we look at the new facility in St. John's in terms of providing additional and 24-hour services for the people of our country. And so we'll also look at those issues, the issue in Carriacou as it relates to transporting patients. That is high on our agenda, and so we are working to ensure that we come up with a workable solution that will make them comfortable in time of sickness. So I want to pass on to the PS. I need her to get her feet wet, and so to speak to us on some of the issues that it relates to our the way forward as it relates to the community health and any other thing she think it is important that I left out that we want to highlight here this morning at this very important press conference, understanding that health is our only wealth.
Thank you so much, Minister. And as mentioned, we'll now hand over to Mrs. Hannah Julianson Paul, the Permanent Secretary, Acting Permanent Secretary, with responsibility for hospital and community health services. Over to you.
Thank you, Ms. Johnson. And I just want to say good morning again to all of you and to our listening public. As persons tasked with the responsibility for the strategic and operational function for hospital and community health services, as Minister alluded to earlier, we would have started having our meetings with our respective management teams. And we would have conducted 2 such meetings with hospital management. And since then, we have identified some of our challenging areas, and we are trying to put together the plan for the way forward. And out of these meetings, what we realized, we came up with some priority areas for improvement over the next year. And these areas included the surgical department, oncology, our diagnostic services, electronic medical records, decentralization of services, the reconstructing of our primary health care services, and also the improvement in our human resources. The reconstruction of our surgical department would take the following format. We already have a plan, and discussions have already been made with the consultants and house officers within the department. We commenced the purchase and continue to purchase equipment in order to equip our surgical department and ensure that we have the capacity to provide that service. We're going to also strengthen that department by hiring a pediatric surgeon / oncologist. So we're getting 2 in 1, yes, to improve and strengthen that department. Dr. Tristan, who is going to be the person delivering such service, he would be performing surgeries for pediatric cases. Most of you might have heard before about our World Pediatric Project, of which Grenada is part of. This project had enabled us to access surgical care in whatever form for our pediatric cases, our children. Because of COVID, we would have seen a lot of the borders of our regional islands has been closed, and that would have affected the access to care. So COVID has taught us that we need to have these sort of specialized service within our country. And because of that, these were some of the reasons that prompted us to recruit the service of Dr. Tristan. So he would be providing that service. The medical director already started collating the names of persons for that service. Persons who also has problems with the urinary tract, like problems with the urinary tract issues, problems with male that have problems with the reproductive organ, like prostate cancers and so on, he would be addressing some of these cases as well. We have also, I'm going to be instituting or recommencing the team approach towards surgery. So we would have 3 surgical teams operating from the 2nd of November, and that approach would enable us to see a reduction in the waiting time for surgeries. We have all heard the complaints of the length of time that a person has to wait for a surgical procedure at our general hospital from the time they first interact with the public service. And we are putting these measures in place in order to reduce this waiting time. So we are proposing, and we know as in everything, sometimes we have little technical difficulties that would happen from time to time, but we are proposing that with that measure, we are going to see persons interacting with the public service from the time that you interact with the surgeon. If you are diagnosed with cancer and need a surgical intervention, your waiting time would be between 2 to 1 month. If for ordinary surgical procedure, other than the cancer-related, we are looking at a waiting time from the time you interacted with the surgeon to up to about 3 months. So we have seen a drastic decline in the proposed time, because we know that previously your waiting time could have gone from 6 months to over a year. So we are really, really happy for the collaboration with the surgical department, and we embrace this opportunity because we're going to see tremendous impact for persons who are on the waiting list. Our oncology department, our cancer program, that area too would see some improvement, because we are aware that cancer has become the leading cause of death in our island. Yes, and again, COVID has, most of our cancer care is sought outside of our country. And because of that, COVID has again taught us that we need these resources within our country. And here we are going to try to develop a partnership in order to be able to improve what we do at our cancer program. This cancer program would not only be based at General Hospital, where we speak about treatment and care, but also that program would be linked back into primary health care, because we have to develop and ensure that the preventative strategies are in place. And we are speaking health promotion and education of our people to empower them to understand why they need to conduct early screening, so that they can be diagnosed early, and therefore they can be referred to care in a timely manner in order to prevent what further complications. We're also going to be looking at our lab services. Presently, we are in the process of relocation of our lab from the old present building to the new phase of the hospital. Our lab services are going to be improved because we are procuring new equipment, and that is being done through the Regional Health Project. It is a World Bank project, which would allow us to, because over the years our equipment have been deteriorating and some of them malfunctioning. So we are improving that department by providing them with new equipment. Over the last 2 weeks, we had 2 technicians on island installing this equipment in the new building. So we do not want to have any disruption in our services when the transfer takes place. We want a smooth transition. Therefore, we are ensuring that all of our equipment are installed, they're operational before that transition takes place. We also are looking at the introduction of laboratory services to Princess Royal Hospital and the Princess Alice Hospital within the first quarter of 2021. And we know that the people of Carriacou would welcome that. The people of Princess Alice would really welcome that because of the cost in transportation, the length of time sometimes that they have to take to get to the General Hospital to do some investigations. So we are trying to reduce the burden on our population and bring services to them, making it accessible and available. We're also looking into our X-ray services within the first quarter of 2021 for Carriacou as well. Since coming in, we have since hired 2 laboratory technologists for the department, because that department is really understaffed, and with the increased amount of demands now in relation to COVID and COVID testing, we really needed to improve the staff quota there, and we have since employed 2 technologists, and we are in the process of waiting on finalization for another 2. The electronic medical records, this area we really have already been implemented, but it has been in primary care. So the electronic medical records is up and running in the primary healthcare services, but not yet at the hospital services. So we are going to ensure by the first quarter of 2021 that the continuation of the electronic medical records are done. This is needed for efficiency in care. It would help to duplicate efforts. It would promote early diagnosis and treatment, as the physician now would have access to the patient record from the time they enter our service, when they are referred to them, and so the plan of care can become an easier process. It would also help us to reduce our waiting time and improve our follow-up care for persons within our system. So the electronic medical records become a very critical part of care for our patients. Decentralization of specialist clinic service to improve access. Presently, we have specialist clinic access at the Princess Alice Hospital for obstetrics, gynecology, pediatric service, surgical services for specialist clinics. However, we are going to improve on that, and we're going to extend that to ophthalmology. We're going to also include orthopedic services there. We're not going to only leave it at Princess Alice Hospital, but we're also going to bring those services at the level of the health center. So all of the other services that presently offered, like pediatric surgery, gynae and obstetrics, we're going to add ophthalmology and orthopedic, and these services would also be available at the health center level. Our goal is to bring the service to our clients, our patients, making the service accessible and available to them. At the Princess Alice Hospital, we have also submitted in our budget for 2021 the first assessment to be done at the Princess Alice Hospital for the introduction of minor surgeries at Princess Alice Hospital. So we are looking to improve in every area and make services available to persons. We would also be looking at our regularization of our staff, especially our nursing personnel and our doctors. We will be looking at regularization, and we hope that this is something that our staff is looking forward to, because I can assure you that we are putting every effort that we have into that regularization. Presently, we are not forgetting our infrastructure. We know we have the second phase of the general hospital is being done. However, we still continue to utilize our first phase, or what we call our current building of the hospital. And so we have to ensure that that building too gets its level of improvement, and we are presently installing 2 new elevators. From time to time, we all hear about the elevator and the issue with the elevator, and the elevator is not working. We are presently installing 2 new elevators at the current building in order to ensure that that facility is up and running, because we know our operating theater and so is on our 4th floor. So we definitely need to have a functional elevator in order to be able to function effectively. Primary health care we have not met with the management team in the primary health care as yet. As Minister said, we are meeting with them this week into next week. But coming out from the discussion with hospital services, we realize that we have to restructure our primary health care services. The purpose for the restructuring of this service is to strengthen our first-line level of care, which we know and which has been proven not only to be cost-effective, but it helps to address our health issues in a holistic way. All right? Especially right now, with the prevalence of non-communicable diseases, we have to look at strengthening our health promotion and our disease prevention within the primary health care. That is our focus going forward, right? We want our primary health care system to be able to attract patients to utilize our primary care. This would ensure that the existing structure and outdated disease profiles do not consume the required resources that we have, but rather that the health centers provide services that are in demand by our patients today. We have already submitted our staffing needs for that restructuring within our budget for 2021, and we would also be doing some renovation on our health centers because I'm not sure if you're aware, but health has taken the approach of the SMART initiative, making sure that our health facilities are smart, they are resilient to withstand whatever health emergencies and disaster that they may face. And we already have our health centers done for smarting come 2021 into 2022. Our new health facility at Grove is not forgotten. We have a new health facility there, and we will be adding some services in 2021. However, our approach to Grove would be introduction of services in a phased approach. We cannot do everything at one time. So going into Grove, we would have the regular services that has been offered presently. We would be adding our dentistry service, and we would be having an extended hour of medical services there with an emergency or on-call service. And when we say emergency or on-call, we mean that the doctor, the nurse, the emergency response team, it will be available at the health facility after the hour of work. So if the extended hour is up to 8 o'clock, after 8, we would have the emergency response team being on call at the facility. So these are some of the areas that we have looked at so far. I know one of the questions that might come, because it has been in the media for a while, is, so before it comes, is dialysis. And it's not forgotten. We have not left dialysis out. Presently, we are just finalizing all of the logistics as it relates to dialysis. And when we come back another time, hopefully very soon, we would let you know the tentative date. But it shouldn't go beyond the first quarter of 2021. Thank you.
Thank you so very much, PS Mrs. Hannah Julian St. Paul, Permanent Secretary with responsibility for hospital and community health services. Colleagues, we do apologize because we are having some internet issues, so we hope you were able to follow either on the GIS channel 22 or on the Facebook page. And here is where we open up the floor for questions. We already had one from Nancy Maguire, so I'll just go ahead with that still while you submit your questions as well. So, the Minister, what are the requirements? It's kind of outside of what we spoke about this morning. What are the requirements for a person returning to Grenada after spending 6 days in St. Vincent with regard to PCR testing?
Well, the truth is we are not here on that thing, but that particular aspect as it relates to COVID. But what I show is that PCR testing must be done across. So it must come with a negative PCR test. From whatever country you're coming from, you must have a negative PCR test.
We have another question. In terms of the equipment that is supposed to arrive as we seek to ensure we have everything in place, modernize the services, how soon will this equipment arrive?
Well, we're talking about different equipment, so... Yeah, so for the urology equipment, we are hoping that in the next 2 weeks or so that will be here, and there are some other equipment that we are hoping within the next month, 2 months, and some before the end of the year. But there are others that will be after the 2021 budget, but it depends on exactly what they're asking about.
You also mentioned about the Adopt Award. What is the process that will be put in place for this?
So we just started the process because it's something that came up while we were cleaning some of the businesses. I think one of our doctors or someone raised the issue of adopting award, and it came across good for the persons who were there, and so we started talking about it, and other business entities hearing about it thought it was a useful initiative. And so we even contacted other persons saying, this is what we are thinking about. And some persons called to say how happy they were with us doing that cleaning, and they were business persons that wanting to be part. So we also let them know that one of the things we are thinking about is adopting a award, where, as I said, the real aim of adopting award is that you will ensure that it is always beautified, so there's no issue of painting issues or molding issues, or sometimes you have one door, a glass from one door, or some door need replacement, simple things like that, just to keep the environment looking clean and welcoming. So that's basically what the Adopt Award is about, and we are expecting more businesses to come up, but thus far we have 7 business entities who will be involved in that process.
Right. What kind of focus, Minister, will be placed on the Mungay Hospital? MTV is asking what kind of focus will be placed on the Mungay Hospital and its development improvement?
Well, as I always said in the past, Mungay Mental Hospital is dear and near to my heart. I have been there many times before becoming minister, and even becoming minister, I have been there, and I understand that and see for my own self that there are a number of issues with patient care, issue with the whole facility. And so in terms of improvement of the facility, we will be looking at that in terms of having discussion with the doctors and see how we can better care for our persons with mental illness, and how it more than just Mungay, because Mungay is just an institution when you no longer can control them at the community. But how do we provide love and care as even family members? So even the education aspect must be there, because Mungay at this present time, we have scores of people there who have families outside there, but they are there in Mungay living permanently. So we want to ensure that families understand that mental illness is an illness as any other illness. If they take the medication and you provide love and care, they can be out with you for a long period. For example, my mother normally stays out for a whole entire year, being like a normal citizen, doing all the things, cleaning and cooking and doing all things. And then maybe sometime later on, it's like a moon kind of thing. She will get sick and having to go for 4 to 6 weeks there, and then back on the community. So we have to teach our families and educate them that mental illness is not a means to throw away your relatives. It's a means that you can care for them, you can love them, you can ensure that they take the medication. And sometimes it's not that easy. So we can sit in a corner and say, well, take your medication. But sometimes it's not easy if you're not there to slip it in their tea, and sometimes they believe that nothing happened to them. And so, but the love and care that you provide as family members must be crucial. You can't just take your families and just like dump them in Mungay and never show your face again. That is unacceptable. It's inhuman. It's everything you could think about. So we want to provide the proper education to our people, to say to them that just like how we have cancer, people lose limbs and also have that, and they're on dialysis and they are home in the community, coming for treatment and going back home. Mental illness is similar, and so must be treated in that way. So education is key in terms of discrimination, because families have to deal with double kind of things when it relates to that. So you deal with the whole issue of your parents being ill and the whole issue of the impact on medication, having them shaky and all that, but you also have to deal with the discrimination within the community. And so our education aspect must be key in terms of ensuring that can happen to any family, and to ensure that family members and even the community at things should understand and be able to deal with that particular issue. So it will be a double approach, a multidimensional approach in how we deal with mental illness and hold facility improvement. But we will be working along with the team to see what can be done to improve and give their facelift and provide better care for persons who are mentally ill.
So as a follow-up to that, Minister, you did mention about love and care. And beyond that, somebody is asking again, what measures are in place to help them to ensure that they do not have a relapse? Are there any things that can be done? Or, as you mentioned, it could be the moon or something, so you never know with an illness like this.
Because there is the community program, so you already have the people involved in mental health having outpatient clinics. So there are the outpatient clinics. They also go to the homes of families. But there are sometimes, I am not sure what the real issue is, because I have to deal with it myself, that a particular period every year, for my mother's case, when she gets ill, every year around the same time, you could as well prepare to say, well, she getting sick a month or two from now. So I'm not sure if and because when you ask her, I mean, why she not living directly, you ask, you take your medication, and she'll always say she takes your medication. Although sometimes medication meet medication day, so that too can be an issue. But I believe that it seems to be a moon issue sometimes. Maybe I could be wrong because I'm not a medical doctor, but just on that particular, dealing with it over the number of years, I think. But still, we will continue the community intervention and see how we can provide more education. But the community intervention, we already have some, and it is happening at present.
Thank you so much. Colleagues, as I mentioned, we were having some internet issues, so we do sincerely apologize again. Are you hearing us now? Callistra, good morning. I understand you were hearing us. If you're hearing us, go right ahead with your questions.
Okay,
Yes, we are most definitely. Go right ahead.
Okay, thanks. Good morning, Minister. Decentralization of healthcare services and the primary healthcare, that's been talked about for a long time. For the last 20 years, at various times, you hear about taking the load off the general hospital and having more comprehensive services at the out districts and so on. What is different this time? You have rolled out an extensive list of engagement programs. What is different this time that can give the public the confidence that the objectives will be met in strengthening our primary health care and decentralization of our healthcare services?
So you would appreciate if we want to move forward. So I do not want to focus on what was said for the last 20 years.
No, I don't want you to focus on what was said for the last 20 years. I want you to tell me what's different now.
The
things that you're talking about, a lot of it were planned and rolled out and never worked.
Okay, so the difference is our commitment to providing those particular services. And in short order, you would see, so seeing is believing. So I can give you 100 reasons now. The fact that it's not happening yet, then you can say, well, I heard that before. So the truth is, I'll ask you to wait for a while and see. So then in our next press conference, you can identify whether things are happening or not happening, because we are putting all our efforts in place. We have a committed team, and so we are working at this time in doing all that we can to ensure that that become a reality.
One of the things we've been hearing recently is that we are strapped for financing. Can you give me some sort of breakdown of where all the money is coming from to roll out these things? What additional requirements are needed to be paid for those objectives to be met successfully? And also a bit more details on Dr. Tristan. Who's Dr. Tristan? Does he have a first name, and what's his credentials and so?
So, in terms of financing, while government has a drop in revenue, you would appreciate that health must be given priority, because without health, we really are dead, and therefore whatever little monies we have for other things cannot be used because health is wealth. So government will be given priority, so from government's fund in some instance, and we also spoke of other regional intervention that is happening that will provide us with some of the assistance that is needed. But the government is committed and will provide all the necessary finances to ensure that we provide proper health care. The truth is, COVID-19 would have given us this unique opportunity in terms of dealing with and understanding and appreciating that we have to put more of our time, our efforts, and resources into healthcare, and so we are doing that. Dr. Tristan served in Grenada before. I think it's Jose Tristan. So he works, and maybe since North St. Paul, the acting PS St. Paul worked with him before, she can maybe give us some more details. But our health professionals are aware of Dr. Tristan. He worked with them here before. He is presently in Spain, but he even worked in other countries in the region at present. So she can tell us a little more of Dr. Tristan. But I know in discussing Dr. Tristan with me from the management of the hospital, he has a wealth of knowledge as it relates to surgery for children and for urology.
Yes, I want to support the information that Minister provided. Dr. Tristan has been one of our surgeon neurologists here in Grenada over a period of time. He would have returned to his homeland, and we realize that there is a gap presently in our service area. So this is one of the reasons why we had to re-engage him again. Dr. Tristan was also instrumental because over the last 3 or so years, the proposal for the introduction of minor surgeries within the Princess Alice Hospital was one of the objectives. He started working with us on that initiative as well. So he has played an integral part within our health system before he returned to his country. So he's not anyone new to our service. Dr. Tristan has been around. He has shown his expertise and competency in every area, and it was something that was proposed by the management team of the General Hospital. It wasn't someone that we engaged on our own. This was the person that was one of the person proposed for that service.
We have another question from our colleagues. Will additional personnel be required to carry out the approach to primary health care? Will additional personnel be required to carry out the approach to primary health care that we're talking about?
Additional persons, currently, if we're speaking about our staffing within any one of our health facilities, staffing is a challenge. So well, if we're talking of additional person in terms of expertise, I would say at this moment, no, because we do not need additional expertise to do what we need to do. Our service is already there. It's a matter of how do we go forward to improve those services. Our health promotion department, we already have a health promotion / education department, is a matter of strengthening capacity at this level in order to deliver the service. So it's not anything new. We are not reinventing the wheel of anything. These structures are already there. It's a matter of enforcing what is there and improving what is there.
Thank you so much, PS. Callistra, you have another question?
Yes.
Okay, go ahead. We're hearing you. Are you there, Callistra?
I'm here, Leslie. And
right.
I'm trouble unmuting myself.
Okay, great. Go ahead.
The operating rooms at the General Hospital, the problem with the airflow quality and the cooling system, I know that the system we were using was not appropriate for that sort of a facility. Specialized cooling systems are required for operating rooms, and we were not using what was up to standard. Have we resolved that problem? I know Cooling Tech was the contractor on it at one point. What's the status of that situation, please?
Presently, the hospital management team is conducting an assessment, and that, what would I call it? That assumption that you would have made, and we are going to, based on the results of our findings, we are going to do everything in our power to ensure that our operating theater has the required and recommended AC units in there, because as we say, our goal here is to improve our services. We want to ensure that our citizens has the best service. So we do not want persons going into the operating theater and at the end of the day where a problem is supposed to be resolved, we create another. We are not here for that. So we are going to put everything that we can in order to improve what we do. But we have to wait on the results.
Thank you very much. Rachel Bain. Sorry, you have another question? Okay, go right ahead. Go right ahead.
In the operating rooms at the moment?
Yes, surgeries are being done because, as I said to you, that whatever is being said We do not have any documented evidence of that at this point in time, right? And the operating rooms, measures would have been put in place to ensure that surgical procedures are being done in a safe environment.
That's it for now, Callistra?
Yes, thanks.
Okay, great. Rachel Bain, good morning, MTV. Are you there?
Good morning. My question, Ms. Minister, is with regards to the mental home, right? Reports are the mental hospital is short-staffed, and oftentimes they have security officers administering medication, including giving patients injections. What does the government plan to do about that?
So, Rachel, the government doesn't have that information that you have. In fact, I visited Monge, met with the doctors, met with staff there, and that never came up as an issue. So this is the first time I'm hearing that is from you this morning.
Do you have another question, Rachel? Rachel, are you there? You have another question? All right, colleagues, anybody else with questions?
If no one else has a question, sorry to be hogging the show. Is the minister in a position? I know she is hospital and health services, but is she in a position to speak at all on the COVID-19 situation? Anything new has developed recently? And with all of your planning and engagement on primary health care, how much of a factor is COVID prevention, the spread of the virus, being considered in your aspect of the health portfolio?
So as it relates to COVID, I cannot give you any information at this time. I'm not privy to any new development as it relates to the COVID-19 coronavirus, and so I am not in a position to give any information on that. As it relates to prevention, well, the whole aspect we spoke about as it relates to education, wearing your mask and all these things is what we have to do in terms of preventing the virus from spreading. So what we have been saying all the time, the education promotion, and that have to be continued, and at the level of the school, at the level of the community, and encouraging our people to protect themselves and their families, build up their immune system, because COVID-19 is here with us, and as it seems, it will be here with us for a while. We cannot shut down the country forever, so it means that as it seems now, we'll have to live with the virus, and therefore we'll have to take all preventative measures to protect ourselves and our families.
Can I just want to add that
Callistra, just hold a sec, Callistra. Callistra, just 1 second. The PS wants to add something. 1 second, please.
I just want to add to that to say that disease prevention, disease surveillance is a critical part of public health, right? And public health falls under the primary health care. So as a result, the identification of diseases, the prevention, control of diseases forms an integral part of primary health care because of the public health nature of which it is. So there is no primary health care without disease surveillance or public health.
So, Callistra, you can ask your other question.
The country, people have been kind of focused on COVID-19 to clean up the country so that we can deal with the dengue problem. I remember years ago when we approached dengue, it was always approached from a primary healthcare standpoint. Anything like that in the works?
It's an excellent observation from you in terms of clean up campaign a national cleanup, but we have not discussed national. What we're doing in terms of the promotion is encouraging families to keep their surrounding clean and to ensure there's no stagnant water, no tires, flower pots and all that, you know, to protect themselves from dengue. But I agree that maybe in our promotions we can look and urge people to be involved in a national cleanup campaign.
Okay, Callistra, thank you. If you have any other questions, just hold a sec. Nancy, good morning.
Good morning.
Right. Yeah, Nancy, go ahead. We're hearing you. Go ahead.
Okay, thank you. I want to go back to mental health and the services provided at the Mount Gay Hospital. In terms of helping people with addiction issues, will you be enhancing the services there? And to combat some of the financial challenges relating to these issues, does the government have any position on getting the producers of rum and beer and the corporate community to support addiction? Thank you.
So let me start with the last part. I believe that corporate Grenada, I mean, maybe you add in terms of the rum factories and stuff and things, so maybe these are people that should come on board, but I know that there are aspects in terms of who are assisting in terms of dealing with rehabilitation and the rehabilitation center. What I can say to you that as part of our 2021 budget, we will be looking at rehabilitation, and so I would not give in-depth information this morning, but it will be at our budget. When that budget is presented, we will speak up to what will be happening in 2021 as it relates to dealing with substance abuse and providing more assistance as it relates to getting people to deal with the issue of alcohol and substance abuse.
All right, colleagues, I think it is time for us to wrap things up here. And again, we do apologize because we are having some internet issues, so that keeps dropping the connection with us. So what I will do is give the PS an opportunity to make any final words that she has, and then we'll have the final word from the Honorable Minister.
Leslie, I just want to say thanks for this opportunity to introduce ourselves and our plans for hospital and community health services today. We look forward to working along with the team that was given to us, and we are committed to providing the best quality care to all citizens of this nation.
Thank you. Minister?
Just to say that I am happy to be involved. It's a challenge. It has been consuming all of my time for the last 2 weeks. When I say all, I literally mean all, because I literally sleep, dream of healthcare, the improvement of the healthcare services, because I believe that I was given that responsibility for a reason, and I believe, as I wrap up, I would say my son, after Prime Minister announced, my son who's studying medicine said to me that you are expected to make a difference. You can't waste time there. You have to do what it takes, and people, all eyes are on you to make a difference. And so I'm aware that eyes are on me, eyes are on all of us at this particular time. And so we are committed to working to improve the health services across Grenada, understand and appreciating that from where I sit in the ordinary realm, I am aware of those issues that confront our nationals and even confront me at sometimes. There are times when I had to even as a minister, visit the hospital with my mother and saw the many challenges. And so we are committed to doing what it takes to improve the general health care. We are committed to working along with our staff. We are committed to dealing with even the issues and challenges that confront our staff. I know in our first meeting, Dr. Donald asked me whether or not she's frightening me, because there were so many issues and so many challenges. But the truth is, when I listen to the team that we are working with, I know the passion, I know the commitment, and so I'm joining with them with passion and commitment to improve the healthcare services of Grenada, Carriacou, and Petite Martinique. You can count on us that we will be making changes, and we're not focusing on all those things of the past. We understand and appreciate that health have a number of challenges, a number of issues, but we'll work together. And we know we can't change everything overnight, but we will do some by some, little by little. We believe that we will be able to change some of the perception as it relates to healthcare in Grenada.
Thank you so very much, Honorable Minister Delma Thomas, Minister in the Ministry of Health and Social Security with responsibility for hospital and community health services, and Mrs. Hannah Julian St. Paul, the Permanent Secretary with responsibility for hospital and community health services in the Ministry of Health and Social Security, giving us a lot of information there this morning. Colleagues, we do apologize once again because we know you missed some of it on Zoom because of the internet issues. Sometimes that happens with technology, but of course you can join the Facebook page. You can get the information on the GIS Facebook page. So for all of you who joined us this morning on Channel 22, our Facebook page, and in the diaspora, and our colleagues who are always with us every Tuesday morning at this time, we do say thank you very much. Have a wonderful day, everybody. I'm Leslie Ann Johnson. Thank you.